Good evening, doctors. Welcome again. And today I'm in front of you to give your. You have a lot of questions regarding examination preparation, short period, and I already start 5,000 MCQs. Those who are very high yield, as you know very well. And I'm going to put all subject wise MCQs. So guys, if I put 500 MCQs, maybe 2 3 I can done wrong. Maybe sometimes it can be happen with anybody. If I attempt 500 MCQs, 2 3 can be. But if you know the right answer, you can write in a comment box. As I saw yesterday video, you are sending a lot of comments. But I am preparing different topics also now with different subjects. I am going to launch soon, but I wanted to clear one doubt of yours that if you done 5,000 MCQs, see here, ये board पे दिखाएं थोड़ा पास 5,000 MCQs if you done, I am 100% sure that you are going to receive at least 100 MCQs from it in 300. It is contain nearly 400 marks. 400 marks. So I want to explain you, and one more question you have. I really want to say your question is my questions are previous year questions are going to repeat. So I'm going to say guys once again. I will give you one example how the questions are repeat. Like question this year I put in my like drug of choice in pregnancy hypertension. Question in this way option like enalapril. I will give you one example. Another is methyl dopa. Okay, सी ऑप्शन हियर इज ये दिख रहा है वर्ड्स विजिबल अच्छे से दिख रहे हैं हाँ methyl dopa. C is hydrazine and D is labetalol. If you think this question can repeat in exam again, it's possible but not 100% sure. So here the answer is alpha methyl dopa, that is centrally acting. But if you are going to sit in another exam, they can ask question is same but change the language pregnancy severe hypertension. Okay, question is same, option are same but language is different. Severe hypertension. Then option is not methyl dopa, option must be labetalol. So this is wrong. Labetalol. And I will give you one more logic here. If they are not going to ask severe, they can ask drug of choice. Drug, not drug of choice like this, drug in pregnancy hypertension which is contraindicated, they can ask in such a way. Same question but language are different every year. So answer is enalapril. So guys, if you know the meaning of all four options of this question, that means you definitely crack the exam. But if you think that this question with enalapril option they will give, you are not right. I don't think so they will give in such a way. I hope you understand. Now I will give you one more example how the questions are going to be repeated, because some students are going to be very angry if they found that questions are not repeated. Questions are repeated guys, but language is same and way is different. Like I will give you one example, one more example. The drug or something another investigation of choice. Let's take example IOC for renal stone. Okay, investigation of choice for renal stone. In exam they will if I write this question, see option 1 is non-contrast CT, option second USG, option third HRCT, high resolution CT scan, option fourth is like I want to say MCU. Okay, so which one? So here in such case for renal stone go for non-contrast CT. If I put this question in such a way, then in exam next exam they will ask in such a way for bronchiectasis. Bronchiectasis. Options are same. Options are all four are same, but answer here different. Go for HRCT, but N non-contrast CT is false. So HRCT is the answer here, guys. I will give you one more example. Like in case investigation of choice for PU valve. It's posterior urethral wall present congenitally in a child. So which one is the diagnosis of choice? No HRCT, no NCCT, that is MCU. Micturating cystourethropography. So options are same, question may be different, or I will give you one more example. Maybe option may be different in such a way, guys. If you know very well, then in such a way questions are repeating. So I will give you the question to practice everything, and I try to explain everything. So guys, please memorize it. Don't think the question, exact question may be repeated. Yes, exact questions are also repeatedly asking. I will give you example. A child draw a circle at the age of what? 3 years of age. Such questions are repeatedly asking. A child draw a triangle at which age? 5 years of age. It's repeatedly asking. Drug of choice in scorpion bite. Sometimes they like to ask, that is prazosin. The drug of choice with BPH and hypertension, that is also prazosin. So guys, in such a way they like to ask questions, and I hope you understand my pattern then. And don't think so they are going to ask last 2018 year questions in 2019 exam. They because they know what question they are going to put. But according to me, if you study in such a way and you are practicing lot of MCQs, practicing, memorizing at least 10,000 or 5,000 MCQ in your brain, then you definitely crack the exam. Because in exam you see like this way, the investigation which is radiation, it contains less amount of radiation which is safe in pregnancy, that is MRI, that is USG. In your mind you know everything. The radiation, chest x-ray, high radiation is contraindicated in pregnancy. If you know very well, then you know everything. In diabetes mellitus, the drug of choice type 2 is metformin. The metformin side effect is weight loss. In type 1 diabetes, the drug of choice is insulin, a drug which give in both type 1 and type 2, that is premilenitin. So guys, in such a way you can answer. In such a way you can answer. If you know the answer very well, you can crack exam easily. And I will motivate you. I will give you a lot of confidence. So please don't be confused. And if you know the answer very well, then you can answer me. You can answer in a comment box. If I wrote, maybe sometime it can be a mistake. If you read any book, there is a thousand MCQs, maybe sometime printing mistake. This option A, answer is A, but the printing mistake write C. So there is a no mistake of professor, but you can correct. You can write in a comment box. Then when I have time, then I can see and write the correct answer. So please study well. Trust me, you definitely crack the exam and you score excellent marks. And all the best for your exam. Please, if you have question, that means I know. Don't be confused. This is your last peak time, so less time in your hands. Study hard. You will definitely crack the exam. All the best for your exam. Thank you. Good day and goodbye.